Welcome to another session of Making It Mark with Atara Estes. Today we will be touching on the topic called community health workers. What are they? Who are they? And how can you get involved to become a community health worker? Short term, we call them CHWs. This has been a definite transition for me to get back in podcasting. Pre-recorded has been one of those you can record, you don't like it. I just have to take a pause off of what I was going forward and to talk about the community health workers. But this makes me a community health worker because I am striving to definitely get the message out about the many topics that is happening around the world, but first starting at home. I am striving, I'm thriving, and I want to make the community so aware of the things that are happening in our everyday. But this has been a very funny time that I can say for me, because I am so particular in how I want to broadcast and how I see myself doing things that I get so much in my head to where now I just have to say, let me let loose. I thank you all for tuning in, being a part of another segment. And as I go forward, just bear with me, because I definitely don't want to discourage you all to feel like I don't know what I'm talking about. I don't know what I'm doing. This is like a trial and error for me, and I plan to improve, but I want to take this to another level for myself. So let's move forward in the topic of today, community health workers. And this is what makes community health workers who they are. They are frontline public health workers who have close understanding of the community they serve. In these communities, community health workers play an integral role in helping systems become more culturally appropriate and relevant to the people the systems serve. Does that look like a definition that you are actually playing a role in? Let's see. I'm a caregiver to my daughter who battles with mental illness. I attend to her every need of the way to making sure that those who she come in contact with on a medical profession, on an education profession, on a continuing on paperwork of Social Security, bank information, transaction of money. I advocate for her. I take care of her necessary needs to help her function and understand how to navigate through her everyday life. I've also taken on the role professionally outside of being a caregiver within my home to be a part of the reentry work. I help young adults from the ages of 18 to 26 to transition from jail, court system, back out into the community. Rather that be from probation, parole, and they have the court order to do certain things with probation, or they get released and they're just needing guidance on helping them to get back on their feet. And I work to sustain them for a period of 6 months to a year, and some even longer, who have been in our program, to help them on their pathway of what they define as success, to turn around the narrative from the criminal justice reform to being a second chance of life. I am a community health worker. Community health workers are the hands-on, authentic support that is relatable to that person that they are serving, to make sure that they get the quality care for the benefits and the resources that are accessible to them. So moving right along with some of the other components that makes a community health worker, you can find yourself not only working in the criminal justice system, but you can also find yourself working in a hospital. You can find yourself working in a health center. You can find community health workers working as doulas. You can find them working as volunteering in a homeless shelter, domestic abuse, safe havens, shelters. You can find community health workers working along with the police, helping them to navigate and provide services and resources to the communities that the police officers are serving as first responders. You can find community health workers, and these are areas that I'm picking out now that could be utilized as a community health worker that has not been adopted. They can be working alongside EMT, fire departments. They do work alongside with mental health liaisons. They work along with other social services that are in the community. And I'm hoping I'm being very clear on where you can find or develop a program to allow community health workers to be in a place of navigation, because they have that trusted relationship, as I said before, with the community, to be that mediator to the system that is in play. So it becomes a shared work to where they translate, the community health worker can translate to make sure that the community is understanding what is being said and what is expected from them. And then we go back to the system to say where their need or the lack, the gap there is, that we can provide a little bit more simplified information being given to them, or better help and access to help the community that seems to be having the barriers that they're going through. So I love the work that community health workers can have and the policies that can go in place to support the work by the code of ethics, of course, that community health workers stand and define themselves as. Some people may just be naturally working in this field and they're not defined as a community health worker. That's how I came into this work. I've been working in the field as an advocate for victims of domestic violence, being a true survivor myself, and coming out of that, being a survivor, wanting to help other women, families to regain their lives, because it is a tragic thing to find yourself in a position like that and have to start all over and don't have any support. So the aftermath came to me of how once I became healthy and whole, and I saw the resources that was available to me, or the lack thereof, I wanted to be that support system to kind of stand in the gap to help in those areas that was for me and that wasn't available for me. So, moving forward, we began to look at a lot of things that I did in the court system. Is my work of expertise, which allowed me to actually get into the work that I'm in. I work closely as a court advocate with the clients to help overturn some of the decisions that are being made to lessen their time in jail or to allow no jail time. I will say that I miss my calling of becoming an attorney, but I love the position that I hold as a court advocate because I still get a chance to work in this sector, being an advocate, knowing my rights to help the community that I'm serving. So, moving forward, community health workers are running the Missouri area. We are a strong workforce that are branching out and from all over the different regions within Missouri. And we have a community health workers conference that I happen to be the president of. It is called CHW's Building Resilience, Tie It Together, Teaching, Integration, and Empowerment. This conference, second annual Community Health Worker Conference, is taking place March 17th and 18th, 2020. The Lodge of Four Seasons. Address is 315 Four Seasons Drive, Lake Ozarks, the Community Health Workers Association of Missouri and the Department of Health and Senior Services are pleased to announce we are having this second annual Community Health Worker Conference. The goal of the conference is to improve attendees' knowledge of community health workers' activities within Missouri and how community health workers can be utilized. Attendance at the conference will also increase community health workers' knowledge about available resources. Now, we do have a deadline that is approaching us quickly, February 16th. So I'm pushing that you all who are interested in attending this conference to go and register your hotel. Get your hotel now so you can get the discount. Mention to them that you are attending the second annual Community Health Workers Conference. The TANTAR is the code that you use, to actually give them that you are looking to get the discount so your room can be held for that conference. The registration for the conference is different fees, but you can find the forms on my website, which is www.ataraestes.com. You will go on the tab that says Community Health Workers Association or Community Health Workers Info. Whichever tab is on there is the one that you click on to get to the registration forms that you will need to fill out in order to register for the conference. February 16th, please register before February 16th and get your room accommodations completed. You are able to register the conference before February 18th by credit card, but you have to download the forms from my website in order to submit your information through credit card, because it's going to close up and not going to be able to accept credit cards. They will only go back to the other format. So you can get your registration in by the 28th and mail it to the office of CHWAM, 722 East Capitol Avenue, Jefferson City, Missouri, 65101. When you download the forms, it will give you all the detailed information. We are looking for exhibitors at the conference. It's a great way to target hundreds of professionals interested in your products and services. The exhibit hall will be open throughout the show and several breaks are scheduled with exhibitors. Booth space is $350 for profit and $250 for non-profit groups, and can be reserved by calling CHWAM at 573-634-2914. There are also several sponsorship opportunities throughout the conference. So please call the CHWAM for more information on the sponsorships. We are approaching our second annual, but it would be my first to host as president of the Community Health Workers Association of Missouri. This conference is one that I would love to set the platform and set the bar high of expectation. We have great speakers that will be in the building, and they will be presenting on such wonderful topics. We will be having, just for example, talking about CHW credentialing. Speaking of, while you're on that website, if you are a CHW and you have completed your certificate course within Missouri, you have a whole year for those who have been already taking the class and been waiting for credentials. See, this is what's happening in Missouri. You have a chance to be credentialed today, and you can click on the link. I have a link that allows you to get your credentials, certifications by going on the link online. It will be $75 for those who are new to becoming a community health worker. And for those who have already been a certified community health worker or a certificate, let me clarify. A certificate, you completed the Missouri course to get the certificate. You can go online and be grandfathered in. You only have until December 1st of this year to complete the grandfathering of credentials for those who have been in, like myself, since 2016. So all of you who have worked hard to get your certificate, completed the course, and worked through all of the overwhelming homework and put in the hours of service and volunteered, or you were employed through, and you still have a passion for this work, get your credentials. You earned them. Get your letters behind your name. Now we're going to be having a speaker. Scott Breedlove will be speaking. He will be speaking with some others about the credentialing. And then we have some great breakout sessions on the oral care. We have missing link, learning in the new circles. You will find myself presenting with my team of the coalition. You got policy designed for maximum benefits, how to intentionally integrate CHWs into the health system. We have changing how we work as CHWs. We have CHWs in pharmacy, a recipe for better patient care, empowering understanding using universal health literacy techniques. And then we end with the reception on that first night on that 17th to reopen on that Wednesday, having breakfast with the exhibitors, and I'll come back and do a welcome. We have understanding Missouri's NEMT tip tool rules. That's for our panel session. Then we have our breakout sessions at Parent Link Navigator Systems of Care, when money is a barrier to good health, helping clients find a path to solving, a doula for everyone, CHWs at the birth and beyond. Another panel of breakouts, building public health system resilience through collective impact, CHWs as interpreters in language and life experiences, rural community resilience. We have framework for effective advocacy, Alzheimer's disease and dementia, supporting those affected. We have how I am helping to build resilience through time. We will have our break and our luncheon with Randall Williams, who is from Missouri, who's the director of Missouri Department of Health and Senior Services. Then we will come back and resume for the last part of our conference of Hello, 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 I Hear an Echo. CHW supervisory training, and last but not least, CHW's advocate, educate, and empower healthier families. And I will give the final remarks. This event is impactful by itself. Yeah, I just said a whole mouthful of what we're going to be doing at this conference. And I would like to see all of the support that would come from you all who are community health workers and who are our allies, or who want to become a community health worker and who want to become an ally to the community health workers movement. We need all of those who are in health worker space to come and be a part. We already got great speakers. We just want to be able to share and develop how to keep moving forward in 2020 and beyond. This is our work. Why not share it amongst one another? Let us learn how to utilize it and to be able to grow from this. We have opportunity. Let's take advantage of it. So we've talked about the CHW conference, but you can become a member as well as the Community Health Worker Association of Missouri by also clicking on the registration form to become a member of that as well. Now, that association is dear to my heart. because my peers voted for me to be on board. And I respect the fact that I earned the vote to actually be in this position that I'm in. And as the president, I wanted to share with you what our mission is. The mission of the Community Health Workers Association of Missouri is to unite CHWs, CHW instructors, employers, payers, and others interested individuals for professional development and community outreach to serve communities in which they are involved. The overall goals of the organization is to advocate and recruit to increase membership, empower regions to increase high-quality CHWs for CHW certification. Integrate and informative Sustainability Missouri CHW collaborative models are for all sections and collaborate to coordinate existing resources and develop new resources to achieve our shared vision. I may be saying a lot of things because I'm a part of it, but I'm saying everything because I'm involved in it. And when I got into this cohort 3 to become a community health worker, I knew the missing pieces that was happening because of the runaround that I was getting for the care for my daughter. Dealing with a child who had a condition that others just wanted to pass her off to someone else because it just seemed like, well, we have given you a diagnosis, but this is not working. And to pass you on to somebody else to say this is not working is a slap in the face for a mother who's doing all that she can to keep her daughter alive. I'm doing that for the community as well. I want to see my community thrive and not just survive. When I got into this role, I had a teacher who told us, I would love for you all to pick this up and take it to the next level. And for those students who were in that cohort 3, took into heart what she had said to us. And we wanted to make an impact to this community that we were serving in the St. Louis area. We didn't know what to expect, but we knew we wanted to expect change. And in order to expect change, we had to apply ourselves to work towards that change. So I got into the job that I'm doing in the reentry work at the Integrated Health Network. I got into the meetings. I learned all the different languages, talking about the systems and the policies and the criminal justice and all the different barriers that I was dealing with that night. And I started coming up with something is wrong. I kept seeing what was wrong. But nobody wanted to come with solutions. Or no one wanted to apply the solutions when they heard a solution. I began to work against those who were resisting. Not in a way to make noise to where it wasn't believable, but I became influential. I wanted to be in a seat, not from the consumer end only, but I wanted to sit at the table. When you sit at the table, you're more than likely to be heard in a different way because you're sitting at the table almost as an equal, but not totally as an equal. But if you're able to get to the table, you have to be heard. So I always ask, I'm talking, are you willing to listen? Because I do have something to say. And I'm not just speaking for my house. I'm speaking for all houses. When I speak for my house, I'm speaking for that block. I'm speaking for that neighborhood. And I learned that from my co-workers who are born and raised from St. Louis, Missouri. See, I'm not born and raised from St. Louis. I was born and raised in Chicago, in the streets of Chicago, and I grew up in New York. And my time on earth has been nothing but struggle, homelessness, violence, gang violence, drug violence. You name it, I've seen it. You name it, I survived it. And I'm not going to apologize for the struggles that I went through to get me to where I am today. So I know if I can turn my life around and if I can make it through, I can encourage you that you can make it through as well. But you're going to have to find your way on how to make it through. I give everyone the opportunity to live the way they want to. And then I come and ask them the question, how is that working for you? Because if it's not giving you the results that you want, you may want to go back to the drawing board and see where you can get a helping hand at to move further. And as you want to move and press forward, pressing towards the mark of the high calling, it takes you to ask for support, ask for help, help from your community, help from your neighbor, help from professionals that are in an area to help you. But if you don't ask, don't nobody know how to help. Don't nobody know that you're hungry if it doesn't look like you're hungry. So sometimes you have to open up your mouth to ask. So I ended up praying to God, asking for him to place me wherever his will was to be. And guess what he did? He put me where I am at today. I got voted to be the co-chair of the HEAL Partnership for the region of the Community Health Workers Workforce. I went from there to develop the coalition, being one of the founders of the St. Louis Community Health Workers Coalition, one of the best in the region right about now, who have strong community health workers, building out strong membership, who has been in existence since we graduated. Building out the community health workers has not been an easy task, but we focused and we built out our network, starting, like I said, from cohort 3. And we've been going strong, even to this present time, building out strategies, putting in the work, putting in the time. In December in 2017, I became the actual, I don't even think it was December, I think November, when I was put in the position of serving as co-chair. And then the grant that I was innovative to ask them, could we reach out for to develop the workforce, was approved in that following year of January, to where we were able to build out the coalition and build out our coordinator and our data analysts to begin to track what the community health workers were all about and how it was going to make a difference in our region. We were then awarded our funding towards springtime of 2018. Then we began to build out our brand, is what we're doing now as a coalition. We want to be the first business model as a community health workforce in this coalition in the St. Louis region. Then I applied, put my name in to become the president of the new association in Missouri, and I won that seat. And that's where I am today. I've been co-chair for the National American Public Health Association for the Community Health Workers section. I've worked on policies. I've been a moderator. I volunteer my services on a national level, and I'm looking to actually expand internationally to partner up with other CHWs. But now as a consultant, we are here to brand ourselves locally, wherever you are, regionally, statewide, nationally and internationally. I plan to go as far as God told me that my eyes could see. And guess what? I'm looking as far as I can. And guess what? I'm not done. Just getting started, and would like to build up others who will believe in the movement that the community health workers are developing. There are deadlines that I have set out. There are resources that I will share. There are so many amazing works that the community health workers are doing right about now. But I need for you all to turn out this conference that I have already made my plea to say, join us at the second annual Community Health Workers Conference. It's at the Ozarks. Go on my website, www.ataraestes.com. Fill out the forms. Leave me a message, and let's continue to make the best 2020 vision come to pass. I have great ideas to have our statewide to go in places and spaces that they've never seen before. I've never done this before, but guess what? I take on this challenge. I take on this challenge on my plate, just like I attend to my family on everyday personal level. I take on the challenge to know that I'm able to take on anything that God brings my way. Will you join me? Will you be a part of this? Sign up today. Become a member. If you're already a community health worker in the St. Louis area and you've completed your community, St. Louis Community College Community Health Workers Cohort course, and you've completed and you want to be a part of this movement, join the coalition. Email me at ataracebookings@gmail.com and inquire about the application to become a coalition member. We're recruiting right about now, so you can be a part of that movement in the St. Louis region. Also, become a member of the Community Health Workers Association of Missouri on a statewide. If you've gotten your certifications and you're not in the St. Louis region, but you want to be a part of the statewide movement, join. I want to come to your area. I want to know the wins and the losses and how we can collaborate and help. We have a meeting coming up on tomorrow. It's a statewide advisory meeting. If you want to be a part of that, email me and I will send you the invite so you can be able to tune in on the meeting, be a part of the call, and a part of the movement for the community health workers. This information is for those who want to collaborate and be a part of our 2020 vision, helping us to get this message out statewide across all sectors. No one is exempt from being a part of it. We just want to know, will you play a part in it? You can be a part of anything, but if you're going to be a part of it, be involved in it. No resistance, but help build. Help us get on the map. Help us to, well, not get on the map because we're already on the map, but it help us to broaden our territory to where we have community health workers all throughout Missouri. St. Charles, I'm reaching out to you. Arnold, I'm reaching out to you. Arnold, Missouri, St. Charles, Winsfield. We're trying to reach out to those areas. We want to be touching every area that is close to, that is within Missouri, that has our community at heart. You might be a community health worker, but called a different title. Guess what? Go on our website, chwam.org. Send in your questions and concerns. If you think that you might qualify as a CHW and you're not for sure, write us. Find out. You may be qualified to get your credentials as a CHW. But remember, you had to have completed community health workers certifications in Missouri. Not just because you're doing things that is within the region or in Missouri area. You had to have completed CHW courses, community health worker courses in Missouri. But you're working in a different title as a community health worker. You can still end up being qualified. So if you have some questions, please go on the website, ataraestes.com, and go on the Community Health Workers Association tab, fill out your forms, go to chwam.org website. If you have any questions about the membership, those questions can be answered. We are raising the bar. We need you to be credentialed. We need you to become a member. We need you to be attending the conference. We just need willing participants who are ready to roll up their sleeves and to help the community that they serve. It's about servitude. Servitude with an attitude. And we're going to do that for our community and yours. So, follow me on all my social media websites. Twitter, Atara Estes. Instagram, Atara Estes. Facebook, Atara Estes. That's my public page. Follow, support. Tomorrow, we will be discussing on self-care, self-love, keeping yourself motivated, encouraged, and moving towards the mark. Continue to being great, because greatness is in you. Until next time, be blessed.